Hi, everyone. This is Cameron from SimRated. I wanted to take this opportunity to introduce you to Joseph De Los Santos, who I've known for many years. And I wanted to thank him for joining us and telling us a little bit about his career path and how he got to where he's at, and to kind of expand everyone's knowledge about different careers. So in order to get started, Joe, can you just tell us your name, your career, and the number of years you've been in that career?
Yeah, sure. My name is Joseph De Los Santos. You call me Joe. I work currently as a payment innovation program management consultant, a mouthful. And I've been in this role for about a year and a couple months. And I work currently at Blue Shield of California, and I've been at Blue Shield for just about 2.5 years.
Cool. That's cool, Joe. Thanks a lot. So since you have such a unique career, I don't think everyone knows what that is. I'm going to move a little bit from the traditional questions and ask, tell us what you do.
Yeah, sure. So in my role, we work with providers to better align incentives to focus on quality of care, while also trying to keep costs steady or see if it's lower. So that comes in a lot of different flavors. So it could be primary care, it could be hospital quality, it could be looking at equity across and seeing how we could better incentivize for more equitable care. In it, we do a lot of research. So pulling back to the work that I did while I was working with you, we do a ton of literature review. When we're developing our designs, we work with a ton of quality folks, providers on conceptualizing of the idea for the payment model. And there's a rigorous process that we go through, working with actuary, working with our clinical analytics folks and our design teams to really vet out these payment models to make sure that when we roll it out to the market, that it really, it's something that meets the needs of patients, but also isn't something that's a pain and deleterious for providers. So we really want to work as partners with providers when we're designing these models, because we want to make sure that we're incentivizing for the right things. In healthcare for a long time, the focus has been around fee for service. So for us, we're trying to do more fee for value. So do more payments for value type things. So in terms of my day-to-day, usually start with reading papers, reading articles, trying to understand what's going on in the industry, then probably go into meetings where we are designing our models. So working with physicians, PAs, actuary, medical informatics, and pressure testing different aspects of the idea, whether that's looking at a care model or looking at the financial model that is driven by the care model. Because we want to make sure that the quality of care is center and that the payment follows and incentivizes on those specific care model aspects.
It sounds like super creative. Like you get to mix of a knowledge of healthcare and be creative about creating these payment models, and then use your healthcare background and research background to interact with all the different professions. Is that true?
Yeah, absolutely. So that's my base working in clinical research as a research coordinator at UCI has been really important for this role in terms of understanding how to read papers, how to understand how things kind of come about, and trying to translate that into, we were working on clinical trials and projects. For this is looking at care models and payments. So it's just translating those ideas. Yep.
Yeah, no, it sounds super. It actually sounds super interesting. Can you tell us how did you get here? Starting back in your high school days, what was your career path that landed you where you're at now?
Yeah, sure. So for me, I think the cornerstone for me is I wanted to help people, and I wanted to help the most people. So in my mind, when I was looking at different opportunities in high school, I landed on, I don't know what it was, but I landed on neuroscience. So I was super interested in that. And I ended up going to UC Irvine for my undergrad. And at UCI, there's courses called Bio 199, where you do the undergraduate research courses and you can join labs. So during my first quarter, researched the lab and saw, can I do research in this neuroscience lab that's focusing on Alzheimer's disease, even before we could officially be part of it. So I reached out. The manager of the lab was really interested, and he allowed me to kind of come in a little early. And then once I did the proper courses, I came in for like actual credit. So did that for a couple of years. After doing that, being in the lab environment, I was like, I don't know if I love the lab, but I don't know if it's for me long term. I think I need to do something more social, more clinical, like with more people. So I initially came in as a biosci student, switched to public health, which really kind of expanded like the kind of boundaries I was thinking about in terms of healthcare and the different interventions. And I took a healthcare management course. In that course, I learned about it's not just nurses and doctors. There's a bunch of different roles. There's this whole admin team and support staff that really makes healthcare actually work. So I shadowed a leader at a local hospital at Hoag, and he brought me along to a bunch of different meetings, and it was really, really informative, like for me, and we had like a lot of conversations about, what's the future of healthcare look like, what are the different roles. So he was really great. And from there,
can I ask one thing? So yeah. It sounds like he was kind of a mentor for you, or maybe a mentor, at least you I mean, I think it's important to understand how getting involved, getting out there and meeting the people and talking to them. It sounds like that was really influential in your career path.
Yeah, I would say I maybe had 2 or 3 conversations with him, and he was a physician executive, but it really made me think, and a lot of the things that he talked about would happen in healthcare over the next 10 years actually happened, in terms of a lot of care moving outside of the hospital, going more out to the communities and stuff like that. So it was, yeah, I would say even though we only spoke a few times, those were really influential conversations.
Cool. I'm sorry to interrupt you. I just wanted to bring that point up. Continue on in your career path.
Yeah, sure. So I was looking at that. I took that course. It was either late junior year or first quarter of my senior year. While I was in school, I worked for this environmental consulting company just because I needed a job. And I had a boss who, when I joined the company, she had just had a mastectomy, and she had a lot of misgivings about the healthcare industry. She didn't really, the doctors for her didn't really listen to her. She had a pretty poor experience overall. So, after a year, she started developing a cough. She went to her doctors, that something was wrong. Doctor's like, we evaluated you, you're okay. So for her, she went out to areas in South America to try to get these different types of therapies that were done here. And I had that job for a little over a year, almost a year and a half. And when she was going for a procedure, she's like, I found a doctor who's figured out what was wrong. I'm gonna have the surgery, and then I'll be able to talk to you later this week. And she didn't wake up from that surgery. She passed away. So the cancer that had been gone had metastasized across her body and her lungs, and she passed away during that procedure. And for me, that was really a moment where I'm like, wow, that patient experience, quality of care, that empathy, is so important and vital, because this could have been, preventable. This could have been preventable. So for me, all right, quality of care, patient experience, those are really the most important things, so that we could really make sure that no one has to go through that, no one's family, stuff like that. So after that occurred in August, right after I graduated. So I was still looking for jobs, and I had no job after that because it was a small company. There was 6 people, and was looking for jobs, and then ended up going to a temp agency. So ended up getting a job at this pharmacy management company, which again, jobs in healthcare you never heard of. It's a consulting company that basically work with hospitals that they could optimize their pharmacy departments and have strategies for funding. So I was an executive assistant for the C-suite that was based like locally. So through that, took notes during meetings, took calls, started looking through like hospital registries and trying to pull information for the team there. And after doing that for 4 months, I had been applying and finally got an interview with UCI, UCI Health for the Department of Anesthesiology. And I was able to get a role as a clinical research regulatory coordinator. So for me, I wanted to like work in a hospital because I wanted to understand like what are all the different roles of hospitals. I want to work with providers because they are the engines of the healthcare system and they do so much. And kind of see like what are all the different roles, and then apply to graduate school. So I ended up going to the role, worked with 30 plus providers, mainly anesthesiologists or pain docs, and worked on a variety of research projects, clinical trials. We did some quality improvement work. I did like a Lean Six Sigma Green Belt program at UCI. It was really, really fun and extremely formative, I would say, in my career, and trying to understand and do things with, thinking of the providers who I work with, like yourself, Dr. Rick. So I would say, that was vital. After doing that for a couple of years, felt like I was ready for graduate school for a master's in health administration, and went out east to Cornell for my MHA. There, I try to take advantage. The motto for Cornell is any person, any study. So I took classes in the business school. They have a hotel school design program. So took a ton of courses across them. There's an institute on campus that looked at the intersection of health, hospitality, and design to inform kind of patient and customer experience. So started a club there, and that allowed kind of access to all these executives who were part of this board of this institute. That was pretty new. So I got a lot of exposure to a lot of different areas. In between my first and second year, I interned at Kaiser in their internal consulting group in Northern California, and worked on patient experience projects from a population health perspective, and then from a primary care perspective, and kind of went all over Northern California interviewing different patients and providers and nurses to really understand what their experience and provide recommendations about areas to improve in terms of access to care. Do you have any questions?
No, does that bring you basically to today?
Pretty much. There's like a little bit more, but just want to make sure. Yeah.
Oh, that's interesting. Yeah.
Yeah. And during my second year of school, I developed my own consulting engagements with Pacific Life and with Hilton around how you could bring wellness and how can we deliver that in different ways to their customers. So I developed the course. I talked to a professor. I talked to the company who were part of the board for the Institute for Healthy Futures, which is that interdisciplinary group, and recruited students, and then we did these projects. So that helped me have a more kind of holistic approach in terms of looking at healthcare and kind of different angles for like different types of customers. I was looking at different roles during that second year, and ended up going to Blue Shield, California. I saw that they were doing a lot of different innovative things to try to kind of really move forward. And I thought, I always thought the payer is so evil, but I was like, you know what? It's 2 years. I'll give it a chance. So I joined the leadership program at Blue Shield called the Shield Emerging Leaders Program. And in that, we rotate into different departments every 6 months. So started in internal audit. I now know where all the skeletons are buried. And then moved into this core and small group strategic planning. So it's more of that sales employer part of healthcare, and learned about that. And then senior markets, which is more Medicare Advantage, Medicare supplements, dual eligible members, and doing strategy around that. And then payment innovation. So that really kind of brought me back to that clinical aspect, and what I was looking for in terms of like bringing that research mind that I have, but also looking at finances and like can we properly align incentives where we're partnering with providers and not dictating things with providers. So that's where I ended up getting my role where I'm at today, designing different payment models.
That is, you have a very unique background. It's really cool. You've done so much different stuff and had like so many unique experiences. It's really neat. Now might be a good time, Mike. You have a podcast, so if students are interested in learning more about all these different kind of business, admin / patient care, how they all interact with payment, they want to learn more about those careers. Can you tell us about the podcast, how it came about, and where to find it?
Yeah, sure. So another thing that, I figured out how to make time when I was in grad school, I had a podcast and radio show where I was interviewing different leaders in healthcare, providers, just different folks to just see kind of what's out there and to learn. I connected with one of my classmates last year who also had a podcast. His was more focused on UCLA and talking to alumni there. And him and then another one of our classmates kind of got together and saw that in healthcare admin, there's not really a lot of podcasts that are aimed at a younger audience. Most of the focus is like, what does this C-suite executive say? And what does this other C-suite executive say? So like, how can we bring this, information about different roles and as well as news to an audience that, is closer to us? And so we reached out to a bunch of different organizations and found a sponsor in MGMA, Medical Group Management Association, who allowed us to, who sponsored us for a podcast for a season. So in this podcast, it's called BYOB, the Healthcare Podcast, Becoming Your Own Boss. And we interview different really young leaders in healthcare. So it's really run the gamut from, hospital fellows, to folks who work in health tech, to investment, healthcare policy, who work in equity, in foundations. So it's really across the board, and we're really trying to provide exposure to all these careers in healthcare. As Dr. Rich was kind of talking about earlier, prior to this call, there's really a lot outside of just being a nurse or PA or MD. In healthcare, there's all this other support that's wrapping around it. So we really wanted to provide exposure. So you can see it you listen to it on Spotify or Apple or wherever you listen to podcasts. But it's just a fun thing, and it allows me to have a little side hustle where I'm learning and kind of seeing other things in healthcare as well.
I think that's an amazing resource. So that's really cool. So a couple final things. If you would share with us your favorite part of your job and your least favorite part of your jobs and kind of why.
Yeah. I think the favorite part of my job is that, I do get the opportunity to be creative, like flexibility, where a lot of times, sometimes there's these models that are out there that have been done and or have been replicated, but a lot of times it's something that's not new. We're just figuring it out. So that, I think, actually, it's kind of a double-edged sword. So it's a good thing and the worst thing. It's like you have that like tabula rasa sometimes where it's like, where do I even go? Where do I even start? But as I said earlier, I work with a team. I have a great team and work with different kind of parallel teams with me. So we kind of work and figure it out together. So I'd say that creative is kind of a little bit of both, where it's just like, where are we going? But once you have like a mind and a path of like where to move forward to, then things start to become clear and obstacles, start getting pulled away.
Cool. And is it and least favorite?
Yeah, least favorite. I would say it's like research. Everything takes a long time to do. So we're designing these models for like, sometimes 6 to 12 months, and then we put it out into the market, and then we see what happens. And once we have provider partners, so it takes a long time to get these things done, but that time is really necessary to make sure that you're designing something that's not hurting people, hurting providers. Like, you really want to do something that's advantageous for folks.
Gotcha. And Final question is there anything you would say to high school students out there who are interested, any advice you'd give them, people who are interested in healthcare careers?
Yeah. If there's any opportunities to shadow with like people who work in hospitals. I know that there's some like bridge type programs. I know in basic science research, there is a lot of like high school summer programs, and those are growing for folks who are interested in healthcare admin, healthcare management. Don't be afraid to reach out to, someone at your local hospital or to myself. I'm definitely open to conversation if you're interested in different careers. Just be curious. I think that's a central thing. That's something that I've tried to be, throughout my career. Like, I have many different interests, and I feel like that curiosity is so important to kind of lead you to, where you should be ultimately. There's being a doctor and a nurse, like you've been both in the past, is great, but there's also, these other roles. If say you faint at the sight of blood, or things like that, like you can still help people at the end of the day. And in healthcare, you could do that from a more individual level or a higher population level, depending on where you go. So there's a lot of gray and a lot of opportunity for someone interested in helping people to join an area of healthcare.
Very cool.